Morning. So I'm gonna perform an easy PAP. So first and foremost, make sure we check the patient's chart, obtain any relevant information, and then once inside, we always do hand washing. We sanitize our hands before going inside to the patient's room. Once inside, of course, we introduce ourselves and at the same time explain the therapy, such as good morning, my name is Anthony from the respiratory care department. So the doctor ordered you this therapy. This is what we call an easy PAP. This positive pressure, and then its flow was being amplified, where it would help you clear up your airways, remove any secretions, and also allow you to cough even more and prevent your lungs from being collapsed. So after that, we of course do our vital signs. Before that, we check the ID band for the patient for any confirmatory purposes. After that is we wash our hands again, apply PPE such as gloves, and then we can proceed in taking up vital signs. Make sure we auscultate it and make sure if the patient is coordinated and comfortable. And if some patients while elderly, we can assist them by sitting upright so that we can position those patients done with this therapy in a proper position. So once done, we also make sure the device is with us, of course. Inspect for any cracks or any misconnections. Make sure everything is complete. So this one, there are two ports on it. With this is we can insert it with this one with this cover with a pressure monitoring port, or if we don't use this one because it's disposable, we can either use it also as long as we cover it to prevent from this hole from exposure to any ambient air. And then the other one is we can also use it together with the oxygen tubing. Insert it, make sure both of these are being secured and tight. With the oxygen tubing, we started up at 5 liters initially. We don't want to exceed the patient's inspiratory flow at more than 60 liters because the oxygen is being amplified. And then with this, make sure we have two options on it, with the mouthpiece, which is normally been done with this device, and even a mask. Just in case the patient could not tolerate the mouthpiece, we can shift it up with a mask. With the mouthpiece, the patient should insert it with a tight seal, and the tongue should not obstruct the mouthpiece. And then at the same time, the patient should hold it up like this, not in an upside down manner, and they should not occlude the back on it. When doing this, make sure we also demonstrate in front of the patient, teach them such as first is take a slow deep inspiration and a strong exhalation. We should not do it in a forceful way, but as long as we are able to let the patient reach a 3 to 4 second exhalation time, or 1:3 or 1:4. So once done, let the patient rest for a few seconds every attempt. So ideally, we should not do this more than 5 times per trial. And then if the patient does complain any complications such as lightheadedness, fatigue, or discomfort, we can either terminate immediately as long as we make the patient comfortable. And then another thing is we can also use it together or in conjunction with a nebulization treatment, so that with nebulization it would help improve their lung function. And then once everything is done, dispose this one already, cover it up to prevent exposure to ambient air, remove the tubing, and then they should not be soaked up in water, allow it to air dry. The mouthpiece should be clean in still water, and then cover it up with a clean tissue cloth and allow it to air dry. And then reassess the patient, obtain any vital signs, make sure we re-auscultate to see if there are any improvements of their breath sounds. And then if the patient does cough every attempt, make sure we have a specimen cup or a basin where they can expectorate. Take note of its color, consistency, and its amount. And then everything's done, make sure we remove PPE, wash our hands. Once outside, we should chart everything, what we observed to the patient, what pressure were they able to reach on this one, with sputum and everything, its vital signs. And make sure we also coordinate with the physician and the nurse staff.